Good morning, everyone. Can you hear me okay? If someone could just pop into the chat. Yes, fantastic. Hi, Joanne. Thank you very much. So we'll just chat for a little bit and hopefully a few more people will come in because I think it's only just 11. So I'm going to first of all apologise if it takes me a moment to get going because I've just still got to work out the technicalities, and it's very strange talking to a screen and I can't really see who I'm talking to. So hopefully we will be able to get going soon. So it's only literally just 11. So I hope a few more people might join in. And it's really good of you all to join, actually, because I know there's a lot of other things going on. So right, we'll just give it another minute or so before I get going. I just want to check. I'm just going to check that we are recording. Yeah, okay, good. So it's a little bit of talk amongst yourselves just for a few moments because I'd like to wait just until a few more people can join in. If you have questions, if you could put them into the question and answer section, that would be helpful. And what I'm going to do is try and answer questions as we go through. And then obviously at the end we'll have some more questions then as well. So just a few of you this morning. I apologise for my background as well. I do live in a very small old cottage, so it does look a little bit cave-like on the computer. So this is where I live. So okay, well, I think I'm going to get started because it has now just gone 11. So yes, so thank you for joining me. I know there's lots of other webinars on at the moment, and sometimes it can be quite difficult to decide which ones to go for. So I'm really pleased that you've taken the time to choose me. You know, it's a very sort of strange world that we're living in at the moment. So we're having to do a lot of this online stuff, and I think actually for me it's been really good because I think I've contacted more people in this way than I may have done when I was regularly going to work. So it's you know, it's an interesting way of doing things. So, and I think probably even when we are back to normal work, we'll probably start doing a few more things like this. So my purpose today really was to talk to you about a career in medical aesthetics, and very much directed at the nurse. But I think some of the information could be useful to anybody else. So just to give you a bit of an overview, we're going to talk about what actually is medical aesthetics, because it's a word that we sort of bandy about. What actually does it mean? I'm going to give a few examples of treatments. Then we're going to have a look at how a career in aesthetics might benefit the nurse and the patient. Then we're going to look at who and what are cosmetic courses and how cosmetic courses can help you through your aesthetic career. Being that it's about nurses, we will need a word on prescribing. And then we're going to look at the support and the resources that the aesthetic practitioner may need to access and look at. So a little bit about myself, first of all. So I'm Melanie Recchia, but I think everyone calls me Mel. I'm a registered nurse, independent nurse prescriber. My medical background is in burns and plastics and accident and emergency for quite a number of years. Prior to that, I was also a beauty therapist, so I feel I've brought some of those skills along into this career as well. I've worked in aesthetics for 14 years, 12 of which have been full-time. And I've worked for a number of different companies. I started off with the Harley Medical Group, a very large company, and I've worked for smaller independent companies. And now currently I have a number of hats. I'm lead trainer for Cosmetic Courses. I'm a member of the Allergan UK faculty. I'm also an accredited trainer for Sinclair and specifically their Silhouette soft thread system. I'm on the board of the British Association of Cosmetic Nurses, the BACN. I'm also co-chair of the BACN Education and Training Committee. I'm one of the senior non-surgical nurses within the private clinic group. I do 1 day a week clinically for them in Buckinghamshire and Northampton. And I also have my own small clinic in Bucks as well called Alchemy Aesthetics. So I have sort of many hats, and every day is slightly different. But it makes for a very interesting working week, really. Although I have to say I'm quite enjoying the time off as well. So what is medical aesthetics? So there's many different terms that we use for this, but so we can call it aesthetic medicine or cosmetic medicine or cosmetic injectables, non-surgical treatments, anti-aging medicine. You know, there's quite a few different terms that we can use to describe what is medical aesthetics. I think it is a developing clinical speciality, and it's quite distinct from plastic surgery. It does provide, we use evidence-based, non-surgical and minimally invasive medical treatments, which in the main are intended to repair, restore and maintain healthy skin. Treatments are performed and should be performed by medical professionals. They are elective treatments done to adults because generally under 18, a lot of the products that we use are not licensed for that age group, and our insurance and everything else it's generally adults that we treat. And it's usually the face, the hands, the neck, the décolletage area. There are other body treatments as well, but in the main, and especially when you're starting in aesthetics, these are the areas that you're probably going to be looking at working on. And these cosmetic treatments, they can really enhance self-confidence and self-esteem in patients and absolutely improve psychological well-being and quality of life for many people when they have areas or features that they're concerned with. So how can we look at the role of the nurse in medical aesthetics? I would say that as a nurse, you can work, you can have an independent career choice, you can work independently, and you can work with total autonomy. And this can be quite different when you've been used to working perhaps in a large hospital with a large multidisciplinary team. You will be using your nursing skills, but you will have to learn some specialist clinical competencies as well. And the BACN actually have got a whole document on clinical competencies, and it takes you through from being a novice practitioner right through to being an expert practitioner as well. You will need some entrepreneurial skills as well. You know, this is business, and if you have a clinic, your clinic will be a business, so you have to have some degree of motivation to work for yourself, because it's not just going into work at 9 o'clock in the morning or at 2 o'clock on a shift. You're going in and it's your business, and you're working in your business, and you're working on your business. But you will be using your nursing skills because you're still going to be managing patients on a journey through assessment, diagnosis, treatment selection, and planning that treatment. You will need to be following up the treatment that you do, and the patient group that we're treating they're quite I think in some degrees they're quite a high maintenance group, so they, you know, they really do want good follow-up care. Plus it's a private industry, they're paying you, so you know they tend to expect bang for their buck, as it were. But you will still need that ability to build and sustain those partnerships with your patients, and this is all basic nursing skills underpinned by respect, trust and loyalty, because also at the end of the day it's quite a competitive business. So these are the things that you need to build with your customers, your patients. It really does give exciting opportunities to practice autonomously, as I've already said, and it's quite a challenging and it's quite a dynamic area of practice, many different things you can do. As you can see by my own bio, there's many different aspects to my own career. But you have to note that these opportunities, they do come with responsibility as well. And it is a legal requirement that all nurses have appropriate indemnity insurance in place and that you maintain your NMC registration. So what are aesthetic treatments? So let's have a sort of a brief look. I don't want to bore you with lots and lots of befores and afters, but I think it's worth just having a brief discussion about what we mean when we talk about aesthetic treatments. What are we actually talking about? So Botox. So everybody talks about Botox, Botox everywhere. Botox is a brand name, so we have to point that out, by the company Allergan, and there are other brands as well. But it's the brand name for a drug called botulinum toxin type A. Very simply put, botulinum toxin type A is a drug that when you administer it or inject it into a muscle, it blocks the release of acetylcholine. Then the muscle is no longer receiving the instruction to move, so it's not getting the message to move. And this causes a temporary relaxation of the muscles that are injected. With regular use, this will prevent and soften the formation of lines and wrinkles caused by expression. So we have to sort of point out that it is temporary, and it does have to be repeated. But this is probably the bread and butter of the aesthetic world and your clinic. Dermal filler, so another very popular treatment. So with dermal filler, most commonly we use a product called hyaluronic acid. Hyaluronic acid is in your skin naturally, so your body recognizes it. So there's very few, if any, problems with reaction. This is manufactured in such a way, it's cross-linked, which is a chemical process that creates like a gel-like substance, so that when you inject it into specific areas, such as the cheeks or the lips, it will volumize or augment. So it's filling in. It's if we've deflated as we've aged, we're reinflating. You know, when that balloon has got a leak and we've gone a little bit baggy, we're plumping it back up again. So it's typically used to restore lost volume in the face or the lips, and we can use it to improve facial contours and maybe things like soften a bump in the nose. So it has many different uses, and there are different types of dermal filler, but the most common is hyaluronic acid. Also within aesthetic treatments, we have skin treatments. And it's a variety of different skin treatments, usually more functional than, say, a beauty salon treatment. A beauty salon treatment would be more relaxing, pampering, soothing, massagey, whereas the aesthetic skin treatments tend to be very functional, maybe a little bit more uncomfortable, perhaps a little bit prickly, a little bit scratchy. And they're used for various different skin conditions, you know, restore, smooth the skin, improve skin conditions such as acne or pigmentation. And examples of these would be your sort of a variety of different skin peels, your laser machines, IPL machines, microneedling, and then you have your cosmeceutical medical grade skin products. So skin products that you wouldn't buy on the high street, you know, and they are very much more effective. So let's just have a look at a few pictures and a few examples. So you know, what does it actually do? What are we doing? So here we're looking at some very typical before and afters of your toxin treatment. You've got your glabella with your really strong frown, because these muscles in this area, they depress, they pull down when they work. and they sort of pull in medially, and then after toxin treatment you can see that she's trying to frown, but nothing's moving. And you can see she's trying to frown because if you look at this area here, you can see her little bunny lines, which can, after a while of having this treatment, you can start to get a little bit of line here, but we can put some toxin in there as well. And then you've got your forehead muscle or your frontalis muscle, which naturally elevates and lifts your eyebrows. And if you put toxin into this, you can see how it smooths the area. So there's some sort of very simple examples of toxin treatment. So if we look at the dermal filler, there's some examples here. I quite like this slide because at this end here, over on the left, we've got the young, beautiful lips, but she just decided she wanted them to be a little bit fuller. So we've augmented, we've used a cannula here just to give some volume and some shape. And then over here on the right, we've got this lady, lovely, 70 years old, just, you know, not overly obsessed with how she looks, but just wanted to get a little bit of volume back into her lips. And I quite like the fact that we've got sort of one end of the scale, we've got the youth down here. Usually when we're doing fillers and treatments on the younger end of the scale, it's more about augmenting or beautification. We're not really repairing or restoring, but when you come up to the other end of the scale, it's a little bit more about restoration and replacing volume. The lady in the middle, this is an example of a sort of a full face rejuvenation treatment. She's actually had here around about, I think it was 4 or 5 syringes of filler, which sounds quite a lot, but if you work on a basis of 1 syringe per decade, actually that's around about right. She was in her 50s and she just felt that she was getting a little bit saggy, a little bit droopy, a little bit flat. Probably an oblique picture might have shown it a little bit clearer. So we've just replaced some volume, and you can just see she's a little bit fuller in the cheeks, little bit smoother in the jawline, small amount into the top lip just to give a little bit of lift, and it just gives a slightly improved, fresher look. And that's what we're trying to do with our aesthetic treatments these days. It's not about actively trying to make you look 25 years younger. It's about restoring, as I say, if you've deflated a little bit, you know, we pump it back up a little bit, put a little bit of that volume back in. And then along with your skin treatments, you know, we smooth the skin. I mean, this lady would benefit, the lady in the middle would benefit from perhaps some IPL or some laser treatments to just take out a little bit of that redness there. So, you know, we're really giving these people confidence. This lady went out feeling amazing, and this young lady here, she was really boosted by her slightly more voluminous lips. This lady at this end at the age of 70 was thrilled with her lips because she just felt she looked a little bit more youthful. So we're really helping these people. Slightly, you know, what can be more impactful, if you look over here, you know, this lady had a real bump in her nose. So by careful placement of dermal filler just above and below the bump, we've been able to give her a much smoother, straighter nose. And for her, you know, she was just much less unconfident about her nose and her appearance. And it, again, really gave her a big boost. This lady here felt she always looked very tired because she'd got this hollowing in her tear trough area. So very careful placement of dermal filler, we've managed to eliminate those dark circles. These, I must say, are 2 techniques that are for the advanced practitioner. So this isn't something that you would learn and do straight away. And with dermal fillers as well, you have to be mindful that different fillers are for different areas. So the filler that you use in the cheeks, you wouldn't use in the tear trough, and the filler that you use in the lips, you perhaps wouldn't use in the nose. So there's different fillers for different places. And this is all part of the learning. This is all part of what you need to learn as an aesthetic practitioner. So how does a career in medical aesthetics benefit both the nurse and the patient? if you look at it from the patient's side, you'll see that, you know, everybody wants to look their best, and it will give confidence. And having these cosmetic injectables, because now we can do these things without people ever knowing that you've had anything done. I think if you go back 15, 20 years, people looked done, but now it's much more of a, we've learned so much more about treatments, you know, that we can really, you know, make people look really good and just fresh, and brighter and less tired, without having to look as if they've had work done. So we can also, though, it's not just about wrinkles, you know, we can also, if patients have got acne scarring or facial asymmetry or the volume loss, we can improve that, and we can make people feel happier about themselves. Excuse me. We can also look at things like excessive sweating. So using toxin, we can actually reduce people's sweating, because that can be quite impactful on people. As a nurse, how is this going to benefit you? You're still using your nursing skills. You're still having to manage patients. You've got patient management, you've got history taking, you need a knowledge of medical conditions and medication. So your previous nursing career will all add towards this. I know sometimes when people move into aesthetics, the nurses that are still working on the front line of the NHS sometimes can be a little bit, you know, feel like you've jumped ship, but you know, you're still treating people, you're still looking after people's well-being, and you've still got to assess, plan and deliver your treatments. One of the things that is good, and what really benefits the nurse, is that you can, sorry, I was just reading a question there. You can run this alongside your NHS work, because what you can do is you can work this to suit yourself and your family. And actually, you only need to start with a relatively small outlay, and you can grow and develop as time goes on, and you will find that your aesthetic career will grow quite organically. So you can't just do your training one day and then you've got a massive big clinic the next. It will grow and it will develop as time goes on. So just had a question about, you know, would you advise a newly qualified nurse to come into aesthetics? I would say, as a newly qualified nurse, I think you probably need to consolidate your nursing career a little bit first, because as I've already said, you're using nursing skills in aesthetics. You need background knowledge of medical conditions, you need background knowledge of medication, because people will still come to you with a list of medications with various medical conditions. So as a newly qualified nurse, I think it's very admirable, if you want to get into aesthetics, to do nursing, absolutely, because, you know, better to be a nurse than not. But I would spend some time, and I think even up to a minimum of a year. As an old nurse, I would say ideally 5 years, working on your nursing career, learning as much as you can about being a nurse, and that will so benefit you when you come into aesthetics, especially when you're having to work on your own. In a hospital, you've got somebody there to ask about a medical condition. On your own, in your clinic room, there's just you. So I think I would say admirable to be a newly qualified nurse, but get some nursing background as well first. So Cosmetic Courses. So who are we and how can we help you? So Cosmetic Courses have been established since 2002, and we are in fact the UK's longest running and established training provider. And interestingly, you'll find many other training companies, actually their main trainers and owners have actually come through Cosmetic Courses. We've got lots of very well established practitioners who started with Cosmetic Courses, and many of our trainers in fact have gone through Cosmetic Courses. I myself did my initial foundation training with Mr Richards with Cosmetic Courses in 2006. We're also one of only a couple of Allergan appointed training providers. And we're also part of the Allergan Spark program, which is aimed at new practitioners coming into aesthetics. And if you sign up to Spark, details later, you will get a lot of support in terms of products, literature, business advice through the Allergan Spark program. And to date, I think we've trained over 7,000 surgeons, doctors, dentists, nurses from all over the UK and all over the world, in fact. And we do courses that go from basic right through to advanced levels, covering all the various injectables and skin rejuvenation treatments. And we've got centres across the UK and Ireland as well. And so we literally can take you from complete beginner through foundation, through the advanced courses, and right through into expert. So we break these courses up. Your beginner courses are very much your basic foundation. This is your learning, where you start. And the way it works is that you come along for a foundation day, and we'll talk about some online opportunities in a moment. But we can take you through that sort of basic beginner, where we learn some basic skills, but enough for you to start working on your business. But then we will gradually take you into more advanced or intermediate courses. We offer lots of refresher courses as well, and observation days. When you start getting into the advanced, we're talking more about lip filler, very popular, but it really isn't something that you can do as a complete novice beginner. Excuse me. With Botox, when we talk about foundation, advanced foundation, Botox tends to be the upper face, but then there are Botox treatments available for the lower face, but these tend to be more advanced because you need to have a very good understanding of what Botox does. And facial muscles and everything. So these are, we work through these different levels, and then you start going into things like the non-surgical facelift. So this is treating the whole face with dermal filler, not just picking up one small part. It's looking at the whole face rather than just individual bits. PRP therapy, so that's platelet-rich plasma. This is another adjunct to anti-aging, and this is sometimes in the media commonly known as the vampire facial. So this is where we take the blood and then we spin it in a centrifuge, and then we inject it back into the face to rejuvenate, because all the platelets are full of growth factors, and it really rejuvenates the skin. Sclerotherapy, so this is where we're treating the fine thread veins on the legs. A common complaint with many ladies, they just don't like those veins on their legs. So microsclerotherapy, we can do that. When you start looking at the advanced courses, the expert courses, what we're now talking about is your non-surgical rhinoplasty. So I showed you the photo earlier of the bump in the nose. So it's knowing how to safely inject your dermal filler, because we now know that there are some areas of the face that are actually quite high risk. So you need to have a good knowledge of your anatomy so that you can try and work at the correct depths on the face, that you're not going to be creating one of our worst dreaded nightmares, the vascular occlusion. But the more you learn and you go through, and this is why you have to start at a beginner level and gradually learn. What else? So as an expert, we also do things like PDO threads or silhouette soft threads, and this is where you can insert threads into this, and they give a sort of a subtle lift. Okay, and then you have other products like Volux is a relatively new Allergan product that has come out specifically for the jawline. So again, you need to have a good understanding of facial proportions, anatomy, to be able to use these products successfully, and jaw profiling, quite common, it's quite a popular procedure at the moment. We also do lots of annual updates, so even people who trained with us a long time ago will still come back for one-to-one courses or refresher courses, because we can make it very bespoke to you. We do also offer the level 7 certificate in injectable treatments for aesthetic medicine. That's probably another whole discussion all on its own, really. But this is another way of becoming qualified, if you like, in your for your injectable career. At the moment, there are no strict mandatory guidelines on what you should and shouldn't have to be an aesthetic practitioner, but the level 7 is one way of having a sort of a plan of action to work with. But you can either do the level 7, which is a more formal qualification, or you can do these one-day courses, because it will all add up to the same thing at the end of the day. Just having a look at a few of the questions that we've got so far. What do you think about paramedic and pharmacist treaters, considering they may not have the same clinical skills? That's again, that's probably a debate for another whole webinar. It's very difficult because they do have some skills, but I think one of the things that we need to really look at is prescribing. And there's many things and aspects to this that we need to look at. You know, nurses do come into this with skills of injecting, and as do dentists and as do doctors. Your pharmacists may have never actually picked up a needle. So it's a good question, but it's a really big debatable question. So we could do that on another day. How easy is it to observe others in practice and secure mentorship and clinical supervision? If you're doing the level 7 course, particularly with Cosmetic Courses, we do offer clinical supervision. Mentorship is difficult, again, because there isn't, we haven't really got approved sort of formal pathways, but mentorship can come in many different ways. It can be with people that you know who are within the business. The BACN, I know, also offer a mentorship program, and with Cosmetic Courses, we can have you come along and observe our clinics. And actually we also have a process where you can come along and have like your own clinic. So you can come in as a practitioner, you treat the patients once you've got to a certain level, and we're just there really to guide you. And then also you can actually then go on and just have clinics yourself. So it is possible. It can be tricky to find. I think one of the questions here, why train with us and not another provider who's cheaper? I think you really need to look at what you're getting for your money. And I do honestly believe that with Cosmetic Courses, you are getting expert training. One of the things actually that we'll go on to shortly is about the support that comes afterwards. So I think I'll come back and answer that as we get through to that, when we get to that section, because I think that's one of the places that with Cosmetic Courses, our USP is that we offer this ongoing support. Excuse me. I have someone asking here, actually, I've practiced aesthetics 10 years ago for 4 years and coming back into it now. Okay, so this is talking about the V300. Again, I'm going to come on to that in a moment, so I think I'll come back to that question. Okay, so we have these various courses, which, as I say, will take you through almost a journey. And you'll see from this chart here that you start off with your foundation, Botox and dermal filler training. And this usually, and up until now, and this COVID situation that we've got, would normally involve a day at one of our centres, and you have the morning doing all the theory, and then you have the afternoon where you break into groups. Excuse me. At the moment, because we're not able to actually provide any practical hands-on training, we have taken the foundation course online, so it is possible for you to do the theory content online, and then at such time we will be able to get you in for the practical training. We also have foundation follow-on courses. We have bespoke one-to-one courses, because your foundation course is just a foundation. It will enable you to go out and start doing Botox treatments. Filler treatments, filler is a very broad subject, and you need to be safe. Filler, in fact, is the treatment that can cause the most problems. So you can't possibly learn everything about filler in one day. And actually, going back to the question about other training providers who might appear to be cheaper, watch out for what you're being promised. You cannot learn on one day how to fill the cheeks, the lips, the temples, the jaw, and everything without having any knowledge of filler at all. So any course that intimates that you can, they're not being strictly truthful with you. You can only learn so much in a space of time. So as you go through, we then have our sort of intermediate courses in purple, and these are kind of adjunct treatments. So intravenous nutrition therapy. So this is IV therapy, where you can provide vitamin C or glutathione, which is an antioxidant, through IV infusions, and it's to help well-being and generally feeling, you know, physically better. We also do rejuvenation. It's an injectable skincare. So there's other, it's not just Botox and filler for lips, let's say. There's other injectable skincare that are available as well. And then you can go on through to your advanced Botox and filler, tear trough, non-surgical facelift, non-surgical rhinoplasty. And as we've already said, you gradually work through this program. A little bit, a word about the finances, actually. You know, is this a profitable business for you? Yes, it can be. The products themselves are quite expensive, so obviously you have that outlay. But in terms of, if you think of patient spend, so just as an example, as a beginner practitioner, you can do Botox treatments. A basic Botox treatment of the upper face can cost anything between £150 and £300. So let's just say 200 as an example. If you have 30 patients who are having Botox 4 times a month, 4 times a year, £200 a time, that's £800 a year per person. Times that by 30, that's £24,000. Yes, you will have to take some of that out for your products, roughly half, but that still leaves you 12,000. If you're only doing 30 patients, you're probably working alongside your NHS job. Take that up to a patient who has some Botox and a bit of filler and some skin treatment, and she's maybe spending £500 with you 4 times a year. You're looking at £60,000. Yes, you have to take, and even if you half that with your profit, that's 30,000. So on top of any other career you might have, yes, you know, financially it can be quite a lucrative business. However, on the back of that, I will say you will spend a lot of time earning that money, because it's not only about the treatment, but it's about the building your business. So just going through again, really, you need to be a member to train with Cosmetic Courses. We only train doctors, dentists and nurses, so we need you to have that registering body behind you. You need to complete your recognised training course, because that will enable you to obtain your medical malpractice insurance. As a nurse, the RCN doesn't cover you for aesthetic procedures or anything aesthetic related, so you will have to have separate medical malpractice insurance. You need to think a little bit about your business plan. What do you want to do with this business? Is it purely going to be something that you sort of do on the side, as it were? Personally, I think to do it well, it needs to be more than that. You don't want it to be just a hobby. You know, to do it well, you need to put more into it than that. So you need to think about this sort of business plan. Are you going to work in a small room from a clinic? Are you planning a big clinic? You're going to have a chain of clinics. Maybe they're things that come organically, but you know, you need to maybe have in your mind how you're going to do this. You need to think about your location. Where are you going to practice? Now, it's a tricky one, because you can't just go and buy big premises usually and set up the whole thing. So very often people will start from perhaps a room at home. There is nothing in the legality of it to say that you can't do that, but it isn't ideal, and I think it can also not look entirely professional. So ultimately what you want is a premises that you can work from. I think also you need to kind of keep home life and work life separate if you can. However, I know lots of people who've started off at home and then they've perhaps moved on to a room in a nice high-end salon or clinic. But you need to, if you're going into premises, you need to look at the business regulations, because there's all business rates and those sorts of things to look at. But I mean, myself, my small clinic is actually a log cabin in my back garden, which works very well for me. I think if I could really have my preference, I would have a location away from my home, but I'm such that I don't have to have people coming through my home. And I know a lot of other successful practitioners with clinics who've either converted their garage or they've got an extension on their house. But gradually you will grow and hopefully expand, and then it won't be just you who's working. You might have practitioners and therapists, and you'll have body treatments and different rooms. So, you know, your location will probably change as you go through. You will need to think about your marketing strategy to obtain your patients. They don't just appear when you put an advert in the paper. The best marketing actually is word of mouth. That's the best way that it works. You're going to need to think about, where do you get your stuff from? You know, this is a bit of a minefield as well. What do I need? What is my emergency equipment? Any course that you do with Cosmetic Courses, we will talk to you about that, and we will talk to you about starter kits. We will talk to you about emergency equipment, because you need to have EpiPens and emergency drugs should you require them. But because of all of our trainers are all very experienced, and a lot of them have got their own businesses, we're very well placed to be able to discuss these kind of things with you. Paperwork, you're going to have medical notes, so these have to be stored securely. You have to think about GDPR regulations. Some people still use paper, but you can also get cloud-based systems where you fill in your patient documentation on an iPad or whatever, and you can store it on the cloud somewhere. So you need to think about that as well. But I think you do have to start with the basics. You practice your basic techniques, work on those, get those to be very good. Then you can start expanding your treatment portfolio. And going back to why choose us, I think this is one of the things that we do very, very well. Whenever you've done any training with us, we are on hand to support and advise you the whole way through. You know, we don't have a time limit. In the situation that we've got at the moment, we have expanded our online academy, and you can do your theory online, and then we will have to arrange the practical training later on for you. At the moment, we've got a foundation course online, we've got a complications online course, facial contouring, lip filler, cheek filler. We've got another course on the different treatments between male and female. So have a look, and there is a discount code, which we will send you the information about that at the end of the webinar. Time is ticking on. I just want a word about prescribing, because Botox, botulinum toxin type A, is a prescription only medication. And so it has to be prescribed. And cosmetic injectables fall under a slightly different prescribing rule than other drugs that you might find in and around hospital, where you can do remote prescribing. Botulinum toxin can only be prescribed following a face-to-face consultation with either a doctor, a dentist, or a nurse prescriber. So if you're not a nurse prescriber, you won't be able to do this. You can administer it, so it can be administered by a nurse without a prescribing qualification, but the actual prescribing of the drug has to be done by a prescriber, and it has to follow a face-to-face consultation. So I think, you know, the advice is, as far as you can, and aim for doing the prescribing qualification. The question earlier about the V100, unfortunately, you can't just transfer it into a V300. You have to do the full course. But when you're doing the V300 course, you will have to have medical supervision, and at Cosmetic Courses we can provide that for you as you're going through the course. So you have to have a certain number of hours. What is difficult is that often with the V300 course, the various universities have slightly differing requirements, so you have to look at your individual university. You can work with a prescriber. And what sometimes some nurses do, they will have prescribing clinics where a prescriber will actually come to their clinic and they will see their list of patients, I don't know, 5 or 10 patients, and they will do the prescriptions. And then those patients will come back. It only needs to be a few days because when you order botulinum toxin, it's usually a next day delivery. But you must remember it is a prescription only medication. The other thing to remember about that is that prescription only medications, it's illegal to advertise them in the UK. So you cannot advertise the word Botox or anti-wrinkle injection. And again, there are going through, I'll give you some resources to read more into that as well as we go through. So going back to you know, being this aesthetic nurse who's working probably a lot of the time now on your own, and it can feel quite solitary. You can feel quite you haven't got the support network that you may have got used to when you were in your hospital. You know, you've got your full multidisciplinary team behind you, so if you have any questions or queries, you've always got somebody there to ask. When you're working on your own, that can be quite a responsibility that you can suddenly feel. So you will need to think about a support network, establish links with other aesthetic practitioners. I think when I first started doing this, or 14 years ago, we didn't have all of these different conferences or BACN or groups to belong to or journals to read. We were very much on our own. So it's much more of a sharing community nowadays. So you will need to, you know, think about the various conferences. We've got ACE, which is the aesthetic, well, there's 2 ACEs now. You've got the Aesthetic Complications Expert Group, and you've also got the Aesthetic Conference and Exhibition, which should have been in April, but was unfortunately cancelled this year. FACE is another conference that's on usually June, July. Again, will probably be cancelled this year. CCR is usually October, so that may go ahead. We have the IAPCAM conference, which is usually September, and this is all about complications. When you go to the conferences, it's a great way to learn. It's a great way to network with other aesthetic practitioners. I would also highly recommend subscribing to aesthetic journals. We have the one called Aesthetics, there's a Medical Aesthetics, there's a Journal of Aesthetic Nursing, which is all written and peer reviewed by nurses. And I can't sort of strongly enough recommend the BACN, which we have a membership of over 700 nurses across the UK and Ireland. There are regular regional meetings, and we have a yearly conference, and it's a really good resource and a support. You know, we have a Facebook page, so any questions, queries, you know, at the moment there's lots of discussion about when can we go back to work, so there's, you know, lots of supportive discussions going on. And then of course we've got Cosmetic Courses, who honestly, ongoing unlimited support by phone or email. We don't have a thing that I know some training providers have, where you've done your course, they'll advise you, support you for 3 months, and then that's it. But we have some nurses who trained with us years ago who still every now and then will ring us or call us or email us asking us a question about their practice or a treatment or something, and this is totally free. We also have a conference. Again, this year we may not be able to do it, but the last couple we've had have been amazing. We've had such really interesting content, and I think the conferences were so well received. The visitors loved it and got such a lot from it. The exhibitors as well really, you know, found it of great benefit for them. We do have various other ways that you can access our training. We have podcasts, we have videos. We've got loads and loads of videos. If you go onto Cosmetic Courses, you'll find them. And of course, we've now got a bigger online course. We also do clinical and business support, and we hold various business events throughout the year, sometimes in combination with other companies like the Spark is often, they have a conference as well, which through Allergan is quite business orientated and can help you setting up your business. So I talked a bit about some resources, and I think these various groups are really worth having a look at. The NMC, if you read through the NMC, it will guide you about being an aesthetic nurse. We have the ACE group online. This is about complications. You join this group online and then you can access their Facebook closed group. ASA, the Advertising Standards Agency, you have to know about the advertising within the aesthetic industry because you can be penalised for getting it wrong. Gov.uk, again, a lot of information there about a business, a small business, running a business, business rates, all of these kind of things. Hamilton Fraser, probably the UK's biggest medical aesthetic cosmetic insurance company. Allergan Spark, very good, sign up to that, lots of helpful information about being an aesthetic practitioner, and also the HMRC as well. This will give you lots of guidance on advertising rules, because it's very easy to fall foul of what you should and shouldn't be doing. So sort of coming towards the end now, you know, I think this is a career that you can build. My career has gone, you know, it's sort of organically become what it is, and I love teaching. I love talking and presenting. So I think you can really utilize your nursing skills and you can really make a fantastic career of this. And then to the point where you're working nationally, and then I've just thrown this one in because I'm quite sort of honoured to have been asked, but I've been asked to be a keynote speaker at the International Conference of Aesthetic Cosmetology. This is all with some really sort of respected international speakers. You'll see on here it's all in Polish because this is coming from Warsaw, although I'm doing it from the comfort of my own home. So you know, you can really make a great career of this. And I just wanted to at the end pay tribute to all the other fantastic trainers that we have as well at Cosmetic Courses. You know, we all have something to bring to you, and we're all absolutely genuinely passionate about what we do, and we're all genuinely passionate about teaching you and making you the best practitioners that you can be as well. So yeah, just a little bit of a shout out to all the other trainers as well. Okay, so that really brings me to the end of the presentation. So I'm just going to have a look at some of the questions that we have. So yes, so Joanne, you asked about the V100 prescriber course. I would recommend you take the V300 now. Wait a minute, she says practice 10 years ago for 4 years and then you're coming back in. I would say you need to kind of get the V300 under your belt as soon as you can, because that's how you're going to then become a fully, totally autonomous practitioner. So really have a good look around and see where your nearest university is, and that if you can do it. It's a very hard course, but it's a very rewarding course, and it's going to really greatly help you in aesthetics. What are the advantages of working for another clinic? Okay, so rather, I guess what you mean is rather than have your own clinic, so it's a little bit what I do. So when you work on your own, you're on your own. So one of the reasons that I really enjoy going to work for the private clinic once a week is that I'm then working within a team. I've got the reception staff and the admin staff, and it's, you know, it's really nice sometimes to just go and work with people, because I think being on your own all the time is probably not good for you. And then I find I talk to the patients too much probably. So I think you can get a lot of benefits. So working with the other company, they will also sometimes send you on various training courses. It also keeps you involved in the business, because if you're on your own in your little clinic somewhere, it would be very easy to not be aware of what's going on in the rest of the aesthetic world. So that's, you know, I don't say that you have to do that, but for me, I enjoy going to work in another clinic as well with other people. And that's one of the reasons that I like the teaching and the training as well, because you get to sort of work with other people. There's another question: would you advise to arrange to have a mentor to work closely with you in your clinic when you start? There are many offering mentoring services, but how do I know they are suitable to mentor? So the problem we have within this industry is the lack of regulation. So a lot of what we do, I guess, is taken on trust. To be very professional and fully be able to be a mentor, you should have a mentoring qualification. And I know that the BACN and I think the JCCP, Safeface, we're all working towards people actually having recognised qualifications in mentoring. You don't, I think there may be people out there who just see it, you know, I'm going to get, I can charge to be a mentor, come along, spend the day with me, give me lots of money. But I think mentoring has to be slightly more than that. So I think what you need to do is look at what people are offering you, what is their background, what is their qualification. When I first started, we didn't have mentors, you know, we sort of learn as we went along, but I guess now, back then we didn't know what could go wrong, so we were a little bit blind to what we were doing. So I think if you can maybe go and shadow someone in their clinic, because I know a lot of practitioners, they just naturally teach you anyway. So just look to see what you're getting when you're getting a mentoring service. Try and get somebody who actually has got a mentoring qualification. So it's a very rewarding career. There's many ways that you can take this career, and you can juggle. In one of our trainers, all of our trainers do different things as well. We've got GPs, dentists, one of our nurses does aviation medicine with British Airways. A few of us still work for the NHS. Some have gone back to the NHS at this moment in time. So you know, there's many avenues that you can take as an aesthetic practitioner. So I'm going to finish off there, and all I can say really now is thank you very much for joining me. If any of you are still here, yes, you are. It's been a real pleasure, and we will email you link to the video of the presentation and some other information. So okay, thank you so much for watching.